here because I'm kind of concerned about you all getting everything straight with the endocrine system, because there are so many different hormones and so many different glands. So, the hypothalamus, which is part of the brain and is a main integrating part of the endocrine system. And we'll see this. Now, it produces 9 hormones in total, but 7 of them are produced and secreted by the hypothalamus. And for those 7, it is pretty easy to recognize something in common with them. You either see an RH or an IH when they're abbreviated, okay? And some of them are paired. So this is growth hormone releasing hormone. So growth hormone releasing hormone stimulates the anterior pituitary to produce and secrete growth hormone. Growth hormone inhibiting hormone does the opposite. It inhibits the anterior pituitary from producing and secreting growth hormone. So these are in a negative feedback loop. Thyrotropin releasing hormone. This hormone promotes the production of thyroid stimulating hormone, or TSH. It doesn't have a thyrotropin inhibiting hormone. There's not one of those produced, but growth hormone inhibiting hormone will inhibit the production and secretion of thyroid stimulating hormone. Corticotropin releasing hormone is the one that stimulates the anterior pituitary to produce and secrete ACTH, or adrenocorticotropin hormone. GnRH is gonadotropin releasing hormone, and it stimulates the anterior pituitary to produce FSH, which is follicle stimulating hormone, and LH, luteinizing hormone. PRH and PIH are like GHRH and GHIH in that they are paired, and this is prolactin releasing hormone and prolactin inhibiting hormone. Again, stimulating or inhibiting the anterior pituitary from the production and secretion of a hormone. All part of these negative feedback loops. Then there are 2 hormones that are produced by the hypothalamus, but that are secreted by the posterior pituitary. So those are oxytocin and antidiuretic hormones. These do not have any impact on the anterior pituitary. These 7 do, these 2 do not. So that is something to keep in mind as you think about the hypothalamus and what it's doing. All of these are going to impact the anterior pituitary. All these releasing hormones and inhibiting hormones, whereas oxytocin and antidiuretic hormone are going to have their impacts directly on, for example, oxytocin's impact on the contractions of the uterus during labor, and antidiuretic hormone has its impacts on the kidney primarily, or kidneys. So there's the hypothalamus, and again, an integrating gland between the nervous system and the endocrine system. Okay, stop for a minute.